When we say health, automatically in my brain, I think of health and mental health. A lot of people don't. Just like a lot of people don't think violence is a public health problem, it's just a criminal justice problem.
There's documentation, quite a bit of documentation of young people reporting PTSD symptoms as a result of kind of continuous exposure to violence.
Researchers have identified that the brain doesn't really fully develop till you're about 25 years old. And several researchers have suggested that the fact that the frontal cortex hasn't fully developed might explain why adolescents in particular do some things that we would think like, what are you thinking?
Well, the Michigan Youth Violence Prevention Center is funded by the Centers for Disease Control and Prevention, and we have been in operation since 2010. We work in Flint, Michigan, and we work in a defined area of the city that has particularly high levels of violence. When we are together with groups of kids, it is very common that someone in their family has been shot. They know someone on their block was killed. It's a really common exposure.
What we do is we said, let's engage the kids as part of this solution. Researchers have pretty much consistently found that most people who are engaging in these kinds of behaviors, gang behavior, they don't really want to be there.
We had a grant from the CDC to develop and implement this youth empowerment solutions idea. And it was based on Marc Zimmerman's work in youth empowerment theory.
We usually do it 2 times a week for about 15 weeks, about an hour to an hour and a half sessions. They're not more school. The sessions are designed to be sort of active learning.
So the kids really are the leaders and the adults are more the facilitators. So there is a group leader, an adult who works with the kids and takes them through this structured curriculum, but most of the activities in the curriculum involve the kids making decisions.
So they'll do a photo voice project, or they'll do a project around African masks and then talk about the masks and how that reflects who they are and how they would then want to interact in the world. And then they learn basically how to do community projects. They design and identify a community project to do. So a mural, a community garden, a rap song. They did a photo voice calendar one year. They did an award ceremony for people who took care of their properties.
And the purpose of it is to engage kids who are middle school age in learning about leadership, learning about their cultural heritage, learning about their communities, kind of thinking critically about their communities and what can make them better.
So they learn a little bit about themselves and learn a little bit of leadership skills, learn how to think critically like we were talking about before, and then actually implement a program. And what we consistently find is that a strong sense of self and identity.
Dan Kildee has met with our kids in the YES program a couple of times to talk about their concerns, and he's been wonderful and very responsive. And there was one interchange in particular that struck me, and he was talking to the kids about violence in their neighborhoods and what they thought would help. And one of them said, we have drive-bys, drive-by shootings. That's what he was talking about. Yeah, there are lots of drive-bys. And another young person said, yeah, but those are only at night. And it was sort of like that was normal. It wasn't so bad because it was only at night. And, when I think about that, and I think about my own neighborhood and what that would be like for me, if I knew about or heard shootings in my neighborhood at night, that would have a pretty strong effect on how I would feel and how I would behave. So I'm just struck by the fact that here are kids 11, 12, 13 years old, and this is a normal part of their everyday routine and the toll that must take.